Hi class, Travis White-Velez here. Just to talk to you briefly about my paper. So I based my paper on community paramedicine, and the reason that I chose this topic is because I think a lot of the times people kind of group those of us who are in EMS into this, small kind of boundary. Pre-hospital medicine is the only thing we know how to do. Load and go is the only thing we know how to do. Knuckle draggers, I've heard. We crayons, pencils, whatever you want to, call it. I've already done the flight aspect of critical care medicine and had a great time, but still wanted more of an interaction with my patient. And I think specifically I chose community paramedicine because it allows you to interact with a patient. It allows you to be there for them, not necessarily when they're just sick, but you still get to help them, either navigate through a process or navigate through, something that they may not understand at the level that we understand it. So we can, we don't have to go to nursing school to utilize that skill set. And I think a lot of people will start to, or a lot of states will start to open up the idea of community paramedics because I found that it does actually save a lot of money. On average, it saves about $13,000 per patient in reduction of hospital readmittance. It wasn't too difficult to find, information on this. A lot of the studies that I did find were based in Canada, the United Kingdom, Australia, and New Zealand, simply because they utilize community paramedics and they utilize paramedics to a significantly broader scope than we do in the United States. I learned, or for me, the biggest impact for this topic that I learned was that educating ourselves to a higher level or to understand a different level of patient care is only going to benefit our patient populations that we serve. I also learned that within community paramedicine there's a kind of another like subgroup that is specifically based on injury and prevention, and I realized that if we can prevent injury in the elderly population, something as simple as fixing rugs or moving rugs or the little plastic runners that people put on their stairs, talking to our elderly population about possibly removing these like that, we can prevent a debilitating injury. And that's something that we have a unique view on because we get to go into these patients' homes, and that's something that nurses typically don't do. My topic plays a role in EMS because as Medicare and Medicaid start reducing the amount of money that or continue to reduce the amount of money that they're willing to negotiate for an ambulance ride, ambulance services are going to have to find other means of, sources of funding to A, keep the doors open, and B, to keep payroll going. I know it's definitely not all about the money, but at the end of the day, we would be naive to think that there is not some financial aspect to all of what we do in medicine. Something that I would want other people to know about this topic is that as of right now in my state, we are obviously dealing with a pandemic, and paramedics are being, sorry, my dog's playing in the background. Paramedics are being called on to do things that we haven't had to do before. And I hope that as, paramedics, we can utilize, this moment, take charge of this moment and show the general public, show, the nursing staff, show physicians that we are more than just ambulance drivers. And then one other interesting fact that I wanted to note was that the American Association of Nurses actually supports community paramedicine because just like every other field in healthcare, nurses are just as thin spread as we are, and they're being called upon to do a lot more, in the same way that paramedics are. With that being said, I think that brings my little my little TED talk, so to speak, to an end. I want to wish you guys the best of luck in your future endeavors, and take care and stay safe out there.